For 65 years, the National Health Service in England has worked at the cutting edge of science to help people recover from illness and to live longer, healthier lives. Then, now, and for future generations. Over the years, we have invested in, created, and implemented pioneering treatments and technologies. But our biggest innovation has always been high-quality healthcare, free for all at the point of need. Today, NHS England is creating a culture to deliver the highest standards of care and the best outcomes for patients.
We have in England one of the biggest integrated healthcare systems in the world. We developed simple things like the thermometer and the electrocardiogram. We've made a major contribution to science through other more significant discoveries in some ways, such as the double helix of DNA. So we have a massive heritage in this country which we should be rightfully proud.
In a time of unparalleled challenges, we must do things differently to continue to deliver on our founding principles. Innovation is the way, the only way, we can constantly improve to continue to provide high-quality care. Innovation in approach, technology, and in structure across the NHS. Innovation that will allow our biggest asset, our people, to deliver the highest standard of care.
Innovation can mean lots of things to lots of people. The definition that we use for innovation, health and wealth was much simpler. It's just about organisations doing something they've never done before, doing something new. And that can be changing a care pathway, it can be a new technology, it can be a new medicine, it can be new drugs. It can be really simple stuff as well as the latest cutting edge technology.
We hear a lot of talk at the moment about cultural change in the NHS. And that cultural change, I think, should embrace a number of areas. On the one hand, it's quite clear that we need to make our NHS more patient or even customer-focused in the way that some other healthcare systems are. But equally, I think the big opportunity for cultural change here is to make innovation everybody's business.
That's why we are launching the NHS Innovation Fellowship, a programme that will help us look beyond our own walls and seek fresh inspiration from some of the world's greatest innovators. We will be working with leading thinkers from the worlds of health, business, academia and science, who will act as fellows or advisors to inspire NHS leaders to champion an innovative culture and place innovation at the heart of everything we do.
So it's people who've been there, done that, enormously successful, have a huge amount of experience and knowledge to share, and they want to share that with the NHS. More importantly, they want to share it philanthropically. There's no charge to the NHS.
The NHS Innovation Fellowship will take a direct and practical approach, with each of our exceptional fellows working with the NHS at the highest levels.
We would probably recruit no more than 15 to 20 each year. That we'd probably do it on a rolling cycle over a 3-year period, which would mean at any one time you'll have a maximum of about 60 individuals. And the support they can provide to the NHS varies. It might be one-to-one mentoring with our most senior chief executives. It might be that they can attend conferences or they can attend events that are run by different parts of the NHS or by the Department of Health.
To run the fellowship, we will work with a partner who shares our passion for our nation's health and can bring expertise and a fresh perspective. With the fellowship, we aim to build one of the world's most prestigious global healthcare communities, a network of leading experts working together to make a direct and lasting impact in England and the wider world, to help us to forge ahead into a bold and healthy future.
We're in the middle of a very difficult global financial crisis which is impacting on every healthcare system in the world. But actually I think our NHS is pretty well equipped to deal with that because we are the largest integrated healthcare system in the world, but we also have a long history of very significant contributions from the academic sector to the advancement of medical science. I believe that our NHS provides a unique substrate for us to tackle the problem, that our academic colleagues provide the catalyst to enable that reaction to happen, and that the global financial crisis will turn up the heat. And that will bring, I think, accelerated, innovative treatments to the patients of our National Health Service.
For more details on the NHS Innovation Fellowship, please visit www.england.nhs.uk/Innovation Fellowship.